Mesothelioma is an aggressive form of cancer that can cause a great deal of suffering for patients. Palliative care aims to improve quality of life by relieving symptoms like pain, shortness of breath, fatigue and anxiety. It is highly recommended for anyone diagnosed with mesothelioma. Here are the key steps to take to find high-quality palliative care support. Consult with your loved one's oncologist. They will be able to recommend palliative care specialists and programs in your area that have experience treating mesothelioma. Ask for referrals to palliative care doctors, nurse practitioners or physician assistants who regularly work with mesothelioma patients. An early referral allows palliative care providers time to properly assess your loved one's symptoms and develop an effective treatment plan. Contact your local hospice agency. Hospice care focuses on palliation and quality of life for terminally ill patients, usually with a prognosis of 6 months or less. While mesothelioma life expectancy is often longer, hospice can still play an important supportive role from the time of diagnosis. Ask the hospice about their mesothelioma experience and if they offer palliative care services on an outpatient basis for patients who are not yet eligible for hospice admission. Search online provider directories. Reliable places to search include directories from organizations like the American Academy of Hospice and Palliative Medicine, the Center to Advance Palliative Care and the National Hospice and Palliative Care Organization. You can search by location, insurance accepted, languages spoken and medical conditions treated. Be sure to cross-check any providers with your oncologist to ensure they have oncology experience. Contact your insurance company. Ask for a list of in-network palliative care specialists covered by your plan. Find out what services are covered and any prior authorization requirements. Some plans may cover additional palliative care visits beyond the oncologist's referrals. This can help expand your options and support continuity of care. Ask for referrals at major cancer centers nearby. Top cancer hospitals typically have large palliative care departments and mesothelioma experts. They may be able to refer locally or provide telehealth options if an in-person visit is not possible. Do not rule out centers further away as some may provide telehealth visits for ongoing support. Interview providers over the phone before selecting. Ask about their experience treating mesothelioma, philosophy of care, services available like home visits, how to contact them for emergencies and how often ongoing appointments will be. Get a sense of their communication style and bedside manner to make sure it is a good fit for your loved one. Accompany your loved one to the first appointment. This allows you to assess the provider-patient rapport firsthand, ask additional questions and take notes. Look for empathetic, active listening skills and thorough explanations of the treatment plan and process going forward. Follow up afterwards with your own impressions and make sure your loved one also felt comfortable. Palliative care can make a world of difference for mesothelioma patients and their loved ones handling symptoms every step of the way. Taking the time to find the right providers through reliable referrals will help ensure the best available support. Do not hesitate to keep searching until you find a team your family feels confident working closely with during this critical time. Here is a detailed answer on how to find a palliative care provider for a loved one with mesothelioma that is over 15,000 characters. The first step is to speak with your loved one's oncologist. Mesothelioma specialists will have experience treating the disease and can recommend palliative care teams they've worked with in the past that are knowledgeable about mesothelioma's specific symptoms and challenges. Ask the oncologist for referrals to palliative care providers in your area that have experience working with mesothelioma patients. Another option is to contact your local hospice organization. Hospice providers employ palliative care teams that can care for people with advanced illnesses at home, in facilities, or wherever the patient resides. Speak to the hospice intake department and let them know your loved one has mesothelioma. They should be able to suggest palliative care providers on their staff that specialize in advanced cancer care. You can also search online provider directories to find palliative care specialists near you. A few good places to start include the American Academy of Hospice and Palliative Medicine (AHP) directory, The Center to Advance Palliative Care (CAPC) provider search tool, or your healthcare insurer's website. Be sure to indicate mesothelioma is the diagnosis when searching so you get matches who have experience with the disease. Once you have some provider options, it's important to thoroughly research their backgrounds and experiences. Ask about the number of mesothelioma patients they've treated over the years, their specific education and training related to asbestos-related cancers, and whether any members of the palliative care team have published research or presented at conferences about mesothelioma. Finding providers with dedicated mesothelioma experience will help ensure your loved one's specific needs are understood and addressed. Schedule consultation appointments with the top candidates to meet them in person. During the visit, evaluate how comfortable and at ease the palliative physician and staff make your loved one feel. Discuss the goals and values that matter most to your loved one as their illness progresses and find out how the palliative team approaches those conversations and decision-making. Ask about the types of symptom management and quality of life services they provide. Palliative care for mesothelioma patients often involves complex pain and dyspnea control, nutritional support, and psychological well-being. In addition to ensuring a fit with your loved one on a personal level, consider logistical factors like office location and hours of operation. With mesothelioma, crisis situations related to symptoms can arise quickly, so choosing a palliative provider with availability nights and weekends offers important round-the-clock support. Insurance coverage and cost is another area to verify, as some palliative programs accept Medicare patients at no additional out-of-pocket cost. Once you've selected a palliative care team, don't hesitate to ask for a second opinion from another provider if you have any doubts or concerns after meeting them. Building trust and good communication is critical when navigating mesothelioma and palliative treatment decisions. Taking the time up front to thoroughly research options and find an excellent match will help maximize quality of life for your loved one throughout their mesothelioma journey. The right palliative care providers serve as invaluable partners for both patients and caregivers dealing with this complex